Good Tuesday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to everyone that's out voting today and who voted in early voting for Election Day. We also want to express our appreciation for our Knox County Election Commission and our poll workers for working incredibly hard over the past several weeks. If you haven't cast your ballot yet, you have until 8 p.m. to do so. But please remember to practice the 5 core actions to help keep yourself and those around you healthy. As announced yesterday, we are not testing today here at Knox County Health Department in order to provide support to our election commission. Those in isolation or quarantine who want to cast their vote today will first need to call the election commission at 865-215-2480, and they will be able to walk you through the next steps to get that done. We will resume COVID testing tomorrow from 9 a.m. to 3 p.m. and will continue with those same hours on Thursday and Friday. We will be holding our next public flu vaccination clinic this Thursday from 3 p.m. to 6 p.m. at the Carter Senior Center on Asheville Highway. We will have both flu mist and flu shots available, but we will not have the high-dose flu vaccine at this clinic. Flu vaccines will be given to children 6 months and up, as well as older kids and adults. If you haven't received your flu vaccine yet, please make plans to attend this Thursday. And as we get closer to the winter season, we want to encourage everyone to practice healthy behavior. That is important during a pandemic or not. And even though days are getting shorter and it's getting chillier, please make plans to get outside, go on a walk or read a book outside and get some vitamin D. Not only is that good for your body, but also good for your mind. And as a reminder, our next Board of Health meeting is scheduled for Tuesday, November 10th at 5 p.m. You can watch the meeting live on Knox County's YouTube channel, community television, or on the Knox County webpage. And now we'll move into the local situation. We have 142 new confirmed cases since yesterday's report, giving us 13,441 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 680 probable cases. We have 12,710 of our cases that are considered inactive, giving us 1,302 active cases. 475 individuals have been hospitalized at some point in their illness, and 64 Knox County residents are currently hospitalized. And unfortunately, we have 2 additional deaths to report today, raising our total to 109. I'll now open it up for questions.
All right, members of the media who are in the Zoom call here, if you'll please enter your questions into the chat, we'll get started. And when you do, please include your name and the name of your organization. So Megan with WVLT, whether you're a healthy person, COVID-19 positive, or in quarantine or isolation, what advice do you have for Knox County voters today?
Again, we ask everybody to follow those 5 core actions that we've been asking them to vote to follow the whole time. And so make sure you wear a mask. Make sure you keep your physical distancing from other people, at least 6 feet. Wash your hands before and after. And then at the polling places, they'll be disinfecting frequently. And if you're sick for this one, call the election commission. If you've been asked to stay home because you have COVID-19 or you're a contact, call the election commission, like we said, and they'll make arrangements for you to come vote here so that you can still do that safely and still follow those 5 core actions here as well.
All right, from Jeff from WATE, can you tell us about how the voting process will happen at the health department today? What steps are being taken to keep this from being a dangerous spot?
So that's a really good point to bring up. And what I want to bring up on that is we're doing it in the same area that we do our testing every day. And so we have separate entrances and exits to keep that separate from our other operations. But just like we recommend to everybody, we treat all of our contacts as if they could be a potential case during testing as well. And we're going to do the same thing here. And so all the same precautions are in place to make sure that people can be safe and that our staff and the election commission folks are safe as well. So we have appropriate PPE. that they'll be wearing. We'll be disinfecting and all of those things that they're needed to do to ensure physical distancing is maintained between the folks. We'll be asking them to wear their mask. All of those things stay in play for this situation as well.
All right, if there are any other questions, if you'll please submit them into the chat feature. Someone is typing.
No problem.
Wait a few more minutes here. We believe someone is typing.
There we go.
There we go. Again, Jeff from WATE. We keep seeing more deaths in the last several days. Any new explanation?
As we've been saying, our case count has gone up in the past, a recent past, and we always talk about how we have, when we have increased cases, then that leads to increased hospitalizations, which we've also had recently in the past few weeks, as we've talked about a lot. And unfortunately, that always leads to increased number of deaths. And I think that that's just following the pattern. It's very unfortunate. And that's really why we always try to talk about as much as we can, limiting the transmission. And that's at all points. We see a lot, again, we've talked about this frequently, of it's when we're seeing a lot of when people are feeling comfortable with their friends or their coworkers, or they're having gatherings at their home, or when you just get comfortable and you let down your guard and you're not following the 5 core actions, and that's when we continue to see spread. And so, as always, we want to encourage folks to really try to limit this transmission, because the dominoes do fall as case counts increase, hospitalizations increase, and then deaths increase.
All right, Megan from WVLT. How should behaviors change as the weather gets colder?
I really think that we want to make sure that we're following the 5 core actions, but that's a little bit more challenging to do when there's more people inside and it's harder to separate as much. And so again, really stay focused on what that looks like. Maybe you need to, in your personal gatherings, limit them even more so. Try to keep things to your household. And if not, really focus on, if you can't go outside, how many people can you have in your gathering or group to keep it so people can separate at least those 6 feet. Encourage the mask wearing and the disinfection of surfaces. All of those things are important. And then again, please stay home when you're sick. But really, we just really need to ramp them up even more so as we enter winter months and more of us are in closed settings together.
All right, Vincent from KNS. The data for November 1st is missing from your website. I'm told that was due to a maintenance issue. Was the data for November 1st rolled into November 2nd? And what happened with that date?
Yes, so there was an update over the weekend. I believe we made notification of that into the reporting system that's used across the state. It was a statewide update, and because of that, we weren't able to pull the data on November 1st, and it is the November 2nd data is November 1st and 2nd's data. And I believe it's noted on the website. If it's not, it is. Okay, it should be noted that way.
All right, and this is kind of related. This is from Jeff with WATE. With the delay in state data over the weekend, can you provide more detail about when the 4 deaths reported on Monday and Tuesday occurred?
I can't. I just know we reported them out the past 2 days. I don't have that information in front of me.
Do you want to talk, Cherry, a little bit about how when they're reported and when they occurred could?
Yes, there is a difference sometimes on how and when they're reported. And so we report them out in our daily reports the day that we've received them. And the actual date of death could have been a few days before that, or even sometimes more further in the past from that time. And we do have a graphic on our website that shows the date of death. And so you can keep track there as well. But we did not hold our death reports from the first. The ones that we reported the past 2 days, we received the past 2 days. Hope that wasn't too confusing.
If there are any other questions, if you'll please enter them into the chat feature. And Vincent is typing.
Okay.
All right, from Vincent with the News Sentinel, are death records available for our local COVID-19 cases? I'm talking death certificates or other documents.
I would have to refer you to the state medical examiner's office for that, Vincent. I'm not sure how those are available and what access there is to those. I don't know that process. So they'd be the best ones to answer that for you.
All right, and Jeff from WATE has asked, the death chart hasn't been updated since the 27th. Will that be updated soon?
That gets updated with the benchmarks Wednesday.
All right, if there's any more questions, please enter them into the chat feature. All right, seeing none, thank you very much for your time today, and we'll see you on Thursday.